Now I would request our DTHS ma'am, Professor Dr. Sunita Sharma, to address all of you and to with her words of wisdom and blessings. Yes, ma'am. Thank you.
First of all, a very good afternoon to all of you. It's been a great pleasure to join this webinar, which is titled Bridging the Gaps in Organ Transplantation, Transcending Barriers, Transforming Lives. This is actually the month of July is a part of the national campaign and has already Anurag Jeevan Sanjeevani Abhiyan. I think सबने रामायण पढ़ी है तो we will think of Sanjeevani. That Sanjeevani is the jadi buti which is supposed to give life. So this is similarly this organ donation is like giving life to others. So it is organ donation is not just a clarity of treatment, but it's an act of compassion. And in our society, in our community, there are still the gaps are there. So we have to fill those gaps. We have to rise above the obstacles before the barriers which are there. Then we can transform lives of others. Now, as we know, there is always a difference between the demand and the supply. Demand is more and supply is less. So we can do two measures. Either we can reduce our demand or we can increase our supply. So reduce the demand itself is already told that we have to work on prevention. So most of the lectures today, I think, are those how to prevent damage to our organs. We should have healthy organs. So the lifestyle, you must have heard recently, most of the celebrities you are seeing, they die, they are having certain cardiac arrest. Recently also one of the death occurs. Possibly there is some products. So we have to be very careful of different types of drugs which are there in the market. We have to pay attention. So you will be enriched by the experience of various parts from talking on the The second aspect is increase the supply. So we have to motivate, we have to convince the society and we use different IC media or different ways to motivate them. And the most critical part is, I think, is the identifying brain stem. But this is a very crucial thing and it's a very sensitive issue also. Because somewhere in the heart of relatives, it remains, there may be possibility the patient might come back. So that has to be explained. Actually, I think there's a talk on this, how to diagnose the systemic. I know it is very difficult decision to be taken by the relatives. When body donation, I have done a body donation to my mother-in-law, and it's very tough decision to take. So brain stem death is still, it's more tougher decision, I think, take, but we have to understand this. So I think this webinar is a very good platform where all the experts from the various parts of the country are talking about this transcending the barriers in transforming lives.